Okay, so as Claire's alluded to, this work fell out of a review to our current health technology assessment processes. And as you're probably aware, with NICE increasing their capacity to take on more health technology assessments, what it's resulted in for AWMSG is a decrease in the number of medicines that are coming to us for assessment via AWMSG. So with that, we decided to look at what work we have been doing and how our resource can be best used by the service to ensure that we're providing advice that is most benefit to healthcare professionals, the service in general, and of course, the patients. So if I just share this flow diagram, as this sort of illustrates the main routes for medicines assessment. So many of you will have heard us talk about the AWMSG HTA process, and that was to appraise licensed medicines that weren't on the NICE work programme. So that was a route that medicines would be considered clinical and cost effective via the new medicines group and then recommended by AWMSG. For mainly off-label medicines, we have the One Wales process, which I'm sure many of you have heard about in this meeting. And those medicines get considered by our OMAG committee and again endorsed by AWMSG. Now, in opening up the assessment of medicines and looking at other ways AWMSG can support the health boards to ensure patients have advice for medicines, we've looked at our horizon scanning elements. That's what are we looking at and what do patients need? What does the service need advice for? So in that sense, we're moving more to a clinician-driven process or a healthcare professional-driven process so that healthcare professionals will be able to submit medicines to AWTTC to undergo a scrutiny to decide whether there's a route for assessment via AWMSG. We'll run that alongside our current process, which involves AWTTC horizon scanning and also, of course, company engagement. So if there's a medicine coming to market where NICE aren't picking it up for whatever reason, then the companies are still entitled to engage with us, so we can consider that. And then we're moving towards having an off-label or unlicensed medicines route and a licensed medicines route, such that licensed medicines will be considered through this new committee that we're referring to as LOMAG, the Licensed One Wales Medicines Assessment Group, and off-label or unlicensed medicines will go via the current OMAG route. And particularly, we're looking to align the processes and ensure, as you can see in the middle of this screen, that we're providing advice where there's identified clinical need and added value to patients and the NHS in Wales. So this table just summarises the main difference between, on the left, our current process, and on the right, our reviewed process. So the process that was outlined on the diagram I've just shown. So we're moving from currently, we would pick up all new licensed medicines regarding of their status, regarding of the clinical need. We had an exclusion criteria where AWTTC would decide whether it meets criteria for appraisal. This was becoming almost unmanageable because of the volume of medicines that were coming to market that weren't going to be available in the UK, but also most of them, of course, get picked up by NICE if there's a clinical need. So we're looking to move to this inclusion criteria such that we only pick up the medicines where there's a need for Wales. And as I've already mentioned, that will be driven by the service and also the patients, rather than relying on the market authorization holder. Currently, we've relied on an internal new submission decision form process whereby AWTTC staff make decisions based on those exclusion criteria to decide on medicines assessment. However, we plan to introduce a scrutiny panel, which will involve input from both lay representation and also or mainly healthcare professionals working on the ground, so that we can get a true picture of the service needs and patient needs, and then decide whether it's suitable for All Wales advice. So I've already mentioned that currently we have a HTA process and a One Wales process. Moving forward, we're looking to open up that HTA process. So there'll be additional route for licensed medicines that maybe don't fit that traditional health technology assessment. The committees I've already mentioned, so we're hoping to align more closely to the One Wales process. So we have a LOMAG committee for licence and OMAG for the off-label. We're proposing that the current remit of NMG as the redefined LOMAG committee will be slightly broader. So what we find with these medicines that don't fit traditional HTA is that really you need the whole picture. You need the patient perspective, you need the clinical picture, and you need input into the wider societal and equity issues. And so the proposal is that LOMAG can make a recommendation based on all that information, and then AWMSG move to a more oversight and governance role. And should they need to question a decision making, then there'll be a channel to do so. So the paper would have been shared with you just before Easter, and I know we have had a few responses and they've been really helpful. We're currently in the process of updating that paper to send to AWMSG in June. So we'll make sure we circulate the revised version to this committee so you have sight of that final paper. I just, before I finish, want to draw your attention to two flow diagrams that we feel sort of summarize the information in the paper, and probably we'd like to draw your attention to, if anything, that you just look at these diagrams, and if anyone's got any comments to drop us an email. So this first diagram, which is in Appendix 1 of the paper, it just shows what I've explained just now, so that all medicines will be routed through the scrutiny panel, who will decide whether there's an option for a licensed medicines assessment or an off-label medicines assessment. They will then go through the committees, arrive at AWMSG, and be recommended or not recommended. Those decisions get forwarded to the Minister for ratification. And with the licensed medicines, they will then move to the New Treatment Fund for implementation at health board level. The second flow diagram, I appreciate there's a lot of words on here, but it was just to illustrate where we're moving to with the licensed medicines. And for those of you who did see the first iteration of that document, this is a new appendix to help clarify the three routes for licensed medicines. So on the left, you've got the full HTA, which due to NICE, we can't foresee us taking many medicines through that route. Hence, we've proposed an interim health technology assessment. So for medicines where there may be a delay in NICE, or there may be issues at NICE that maybe don't apply in Wales, and the company can offer us new evidence or additional evidence, then that is potentially a route for AWMSG to consider a licensed medicine. We would need company engagement, and we'd also need to pull on health economic resource at AWTTC to ensure that we can present a clinical and cost-effective picture for that medicine. And on the right-hand side in light blue is more a route where medicines maybe don't fit traditional HTA, and these may be medicines that haven't gone through NICE. They haven't been topic selected at NICE. They may have NHS England commissioning advice, which obviously doesn't apply in Wales. There may be access in other areas nationally, which there isn't in Wales. So we've established a number of criteria for each of those three routes, and we're hoping that through pilot we'll be able to test drive or test run these routes, and in 12 months' time look to review the new process and make any updates as we need to. I guess the take home here is just please do, if you get a chance, look at that document when we send it to you, and just be aware that now there is a point for engaging and highlighting medicines if you feel there's advice missing, and also to probably highlight that we're looking through reviewing this process to open up that lay membership on our steering committee and also on the scrutiny panel. So it's probably a watch this space, and I know we're a bit tight on time, so I'll finish there. Thank you.